Good day, everyone. Welcome to my channel again. Today we'll be talking about preeclampsia. Now, what is preeclampsia? Preeclampsia is a state of having high blood pressure during pregnancy, whereby a pregnant woman has high blood pressure during pregnancy. It indicates having high levels of protein in the urine, which can also indicate kidney problem. Now, preeclampsia, if left untreated, can lead to serious fatal problems for both the mother and the child. Now let's look at the symptoms of preeclampsia. The first symptom of preeclampsia is having high levels of protein in the urine. When there are excess protein in the urine, this indicates preeclampsia. The second symptom is decreased levels of platelets in the blood. When there are decreased levels of platelets in the body, it indicates preeclampsia. Another symptom is severe headache. When a patient is having severe headache, when a pregnant woman has severe headache, it can actually be a sign of preeclampsia. Yeah. Another one is nausea or vomiting. When a patient is having nausea, when a patient is vomiting, it can be a sign of preeclampsia. Yes, another sign is blood vision. When a patient is having blood vision or loss of vision, it can be a sign of preeclampsia. Let's look at the causes of preeclampsia. Preeclampsia does not have any direct cause. You can't say it has any direct cause, but you can say stress and lack of rest can lead to preeclampsia. It is a cause that is one of the causes of preeclampsia: stress and lack of rest. When a pregnant woman is not resting well, is not sleeping well, it can lead to preeclampsia. It can lead to high blood pressure during the pregnancy. Now let's look at the risk factors of preeclampsia. The first is diabetes. A diabetic patient can have preeclampsia. Yeah, a type 1 or type 2 diabetic patient can have preeclampsia. The other risk factor is preeclampsia in a previous pregnancy. Like when a pregnant woman had preeclampsia in a previous pregnancy, it can lead to preeclampsia in the new pregnancy, which means she had the previous one can actually lead to the new preeclampsia in the new baby. So that's why preeclampsia in the previous pregnancy can also be a risk factor for having preeclampsia in another pregnancy. When a woman is pregnant with more than one baby, when you're pregnant woman is pregnant with more than one baby, like twins or triplets, it can lead to preeclampsia. Another risk factor is chronic high blood pressure. When a patient already has high blood pressure, it can lead to high blood pressure during the pregnancy. When a patient is already a hypertensive patient, gets pregnant, she can also have high blood pressure during the pregnancy. Another risk factor is kidney disease. When a patient has kidney disease, this can lead to preeclampsia. And another risk factor is use of in vitro fertilization, that is IVF. This can lead to preeclampsia. Yes. Now let's look at the conditions that can lead to preeclampsia. One, we can see obesity. Obesity can lead to preeclampsia, whereby the pregnant woman is overweight, her BMI is overweight. It can lead to preeclampsia. Yes. Another condition that can lead to preeclampsia is having a new baby with a new partner. Like when a woman changes her partner and having a new baby for another man, it can lead to preeclampsia. Another one is complications during previous pregnancy. If a pregnant woman had complication in a previous pregnancy, it can lead to preeclampsia in the new pregnancy. Yeah. Another condition that leads to preeclampsia is maternal age of more than 35. When a pregnant woman is more than the age of 35, it can lead to preeclampsia. Or when the woman is lesser than 17 years, it can lead to preeclampsia. As she's pregnant, when a lady of less than 17 years is pregnant, she can develop preeclampsia because of her underage. Or when the maternal age is more than 35, it can also lead to preeclampsia. Now let's look at the complications of preeclampsia. We can say preterm birth, we can say placenta abruption, fetal growth restriction, whereby the baby does not grow anymore. There's fetal growth restriction. That's a complication of preeclampsia. And you can say eclampsia. Eclampsia is a state of having convulsion during pregnancy. When a pregnant woman starts having convulsion during pregnancy, it is a complication of preeclampsia. Next, I'll be talking fully about eclampsia, which is the convulsing during pregnancy due to preeclampsia. So now let's talk about the ways of managing preeclampsia. There are two ways of managing preeclampsia. It's lifestyle choices and medication. On these lifestyle choices, we can say attending your antenatal early. Going for antenatal can help to prevent preeclampsia. Checking your blood pressure every time can help to prevent preeclampsia. Then medications, whereby a woman is already having high blood pressure, she taking medications can help to prevent preeclampsia during pregnancy. So when a pregnant woman is taking her medications properly and always, it can help to reduce preeclampsia in pregnancy. And I said earlier that if preeclampsia is left untreated, it can lead to serious complications for both the child and the mother. So preeclampsia is very, very necessary to be taken care of. It requires medical attention, like quick medical attention. So I urge every pregnant woman out there to make sure she goes for antenatal early, eat the right food, eat a healthy nutrition, make sure she doesn't play with her exercise properly and regularly, and make sure you always go for your antenatal. And if you notice any slight change during pregnancy, she should make sure to meet her healthcare provider and explain to him or her how she's feeling. Thank you for watching my video, and I urge you to like, comment, and subscribe for notifications for more videos and updates. Thank you.